Let's look at this. So, can you tell me what is the answer here? Yes, so this is a bilateral hydrosalpinx. So, the modality is HSG, and you are seeing grossly distended bilateral fallopian tubes with distal obstruction. So, this is a bilateral hydrosalpinx. So, is it a mild disease or a severe disease? So, because it is distorting the shape of the fallopian tubes, bilateral hydrosalpinx is a severe disease, and this woman is very likely to suffer from chronic pain, infertility. So, if this lady comes to us with infertility and this is the finding on HSG, what will you advise her? So, whenever there is a severe tubal disease, we must advise IVF, right? So, the treatment of infertility with hydrosalpinx is going to be IVF. But what you also have to know is, although the treatment no doubt is IVF, but before IVF, we should do what? We should do actually either a bilateral salpingectomy or we should do a bilateral tubal clipping. Please understand, they are not the treatment of infertility. So, whenever they ask you what is the treatment for infertility, please don't answer it as salpingectomy and tubal clipping. No, that is not the treatment of infertility. The treatment of infertility is IVF. You are doing these procedures to improve outcome of IVF. Why? Because if you don't do this, then IVF outcomes are very poor because the fluid in the hydrosalpinx is petotoxic. It is toxic to the embryo. Yes? So, it will not result in a pregnancy. So, you are doing these procedures to actually improve the outcome. Is that clear to everybody? Okay. In which phase of the menstrual cycle do we do HSG? So, remember, it is done in the post-menstrual phase. Okay, so it is done in the post-menstrual phase. It can be done anywhere from day 5 to day 11. Most commonly, we do it on day 10. Yes, so most commonly, HSG is done on day 10. Remember, we sometimes ask you investigation of choice for tubal patency. What will you answer? HSG. Okay, so investigation of choice for tubal patency is HSG. Is that clear to everybody?